Every day, millions of Americans rely on insulin to stay healthy, but the average cost of that drug has more than tripled in this century. Nearly all the supply comes from just 3 companies, and consumers and the government have been pushing them to make insulin much more affordable. Now, one of those drug makers, that's Eli Lilly, says it does plan to slash insulin prices by up to 70%. It's also expanding a program that caps most patients' cost at $35 a month. That's great news. Lilia Luciano reports on the lives that are at stake here.
Nearly 8.5 million diabetic Americans rely on insulin to control their blood sugar levels. And a 2021 study says the high cost has forced more than 1 million of them to ration their doses, a calculus that could be deadly.
The price of insulin directly resulted to the loss of my child.
Nicole Smith-Holt says her 26-year-old son, Alec, was one of those patients after he aged out of her insurance.
He was asked to pay $1,300 a month without insurance.
Alec rationed the insulin he had left.
He lasted about 4.5 days doing that.
He was taking Eli Lilly's Humalog, which was $21 a vial when it hit the market in 1996, but has since jumped to more than $274. Now the company is cutting the list price of most of its brands and capping the cost to patients at $35 a month. Eli Lilly CEO David Ricks.
How do you ensure patients that we're not going to see the same rises in the price of insulin in the future?
You know, we haven't rolled out a guarantee, but what I'll say is over the last 5 years, we've frozen list prices and cut them. This is a dramatic cut, but the trend is definitely down. Except for our newest products. You know, we're researching new insulins, and many people with diabetes would say they need better ones.
Smith-Holt calls it a victory of advocacy, but it comes too late for her family.
I think if the price of insulin in 2017 had been $35, Alec would still be alive today.
For CBS Mornings, Lilia Luciano, New York.
We hope it stays $35 for other patients for a good long time.